standing up in some cases. And I want to introduce to you each of the premiers and give you a little bit of a sense on what they're doing. So, here in Nova Scotia, there is Premier Daryl Dexter. Hi, Daryl. Premier Dexter, to his credit, has been going across the country and saying that the federal government's cuts are wrong, and that they will disproportionately impact provinces like us here in Nova Scotia. You've got David Allward from New Brunswick. Brian. Hi, David. So while Daryl's a New Democrat and we might expect him to protect healthcare, Allward is a conservative and is also speaking out against Stephen Harper's cuts to public healthcare. Premier of PEI, Robert Giz. And we've got a lovely busload of folks here from PEI to join us. Welcome to Nova Scotia. Premier Giz has been the chairperson of a task force against these cuts and pushing for new financing options that would help small provinces like those of us here in the Atlantic. And Premier Giz is a Liberal, so that's 3 parties opposing these conservative cuts. And then we've got the Premier of Newfoundland and Labrador. Where's Kathy?
Yeah. Where is she? Kathy, where are you?
Hey, there we go. And again, this is a conservative premier that is coming out and speaking against the cuts that Stephen Harper is making. In fact, the 4 Atlantic premiers have been working very closely together, and they are the most progressive on this issue. In fact, they've agreed with our call to protect healthcare from privatization, to strengthen it with new national standards and funding, and to extend it to include other services Canadians need. So the Atlantic Bloc is certainly the strongest folks we've got on this one. Moving west, we've got Premier Jean Charest. And you'll see on Mr. Charest there is something that says Law 78. Law 78. This is the anti-democratic legislation that Charest has passed. And while we might be talking about healthcare today, we recognize that the social determinants of health, things like education, poverty, and housing, play a huge role. Premier Charest, though, to his credit, has opposed the federal government's cuts to public healthcare. Next up is Premier Dalton McGuinty from Ontario. There we go, in the back. Premier McGuinty has been very strong against the federal cuts to public healthcare. Of course, he's also cutting healthcare funding in his own province, but he has certainly spoken out against the federal government's cuts to public healthcare. Moving into the West, and the Western premiers are the most divided on this issue. On our side, and on the side of public healthcare, is Greg Fellinger from Manitoba. And the Manitoba government, along with the PEI government, have been leading the task force on financing to make sure that we can get a good deal from the feds. But as we move west, it gets a little more complicated. Premier Brad Wall in Saskatchewan, right there in the back. Premier Wall has not come out against the cuts to public health care. In fact, he said that the federal government needs to reduce its budget just like the rest of us. Shame indeed, Premier Wall.
Shame, double shame, triple shame.
Then we've got the Premier of Alberta, Alison Redford. Alison Redford is the one premier that actually supports these cuts and has come out saying that she supports them.
Shame, double shame, all shame.
And finally, out of BC, we've got Premier Christy Clark, who on one day opposes the cuts, and the next day seems to support the cuts. It's really unclear where Christy Clark stands.
You can't make up a mind.
Those are your 10 premiers, folks. And what we said again, we don't want our premiers to be puppets. These are images of our premiers, but we don't want them to be puppets. We want them to